All right, well, hello. I'm delighted to introduce my new friend, Dr. Mary Chapin.
Christy.
We'll start again.
It's
I don't know
because
why I
of
said
Mary
Mary.
Carpenter Chapin, or
Yeah,
Mary
I don't know.
Chapin
I
Carpenter.
have no idea why. This is why I should probably read it when I. Sorry, Christy.
That's okay.
It even says on the screen if I looked at that. Well, I'm delighted to introduce my new friend, Dr. Christy Chapin. She's an associate professor of 20th century U.S. political, business, and economic history, as well as capitalism studies at the University of Maryland, Baltimore County. They're the ones who upset Virginia, right? In the
It's my alma
16th.
mater.
Yeah. Oh, that's extra painful there for you.
Yeah.
Published by Cambridge Press, University Press, Chapin's book, Ensuring America's Health, the Public Creation of the Corporate Healthcare System, won the Business History Conference's 2016 Ralph Gomori Prize, which recognizes the best historical work on the effects of business enterprises on the economic conditions of the countries in which they operate. That is the book we're going to talk about, but she's also published work on historical topics such as Black-owned business, home mortgage markets, the life insurance industry, banking, and the history of medicine as a history of capitalism. Currently working on the manuscript titled The Financialized States of America, How Banking and Finance Shaped Capitalism, Governance, and Life in the United States. She's been a visiting professor at Johns Hopkins University through a Kauffman Foundation grant for the study of the history of capitalism, and she has a number of fellowships, for example, from the Library of Congress and the American Council of Learned Societies. Well, Dr. Chapin, thank you so much for joining us and for introducing you to my audience with your history of medicine.
Thank you for having me.
So we've talked on this show a number of times briefly about the history of medicine, and I will also, it's sort of like a cartoonized version of sort of how we got where we are. We talk a number of times about the problem of third-party payer systems and how it's, there's a disconnect between the consumer and the person providing the services, that, there's this person in between, and it's sort of caused all the distortions in the market that we expect. There are people getting around this, like direct primary care, who are doing the direct consumer, and there's more direct contracting. So the story is always like, well, in the 50s, sort of right after World War II, there were wage controls. And so ways for people to get around this, employers had to offer some sort of way of attracting workers. And so they offered benefits in the name of health insurance. And then that sort of morphed into other things, Medicare evolved from that, and et cetera. This is sort of like, I listened to a American Revolution podcast, and you can start with the Boston Tea Party, but if you don't have any of the context before, so like why people are, angry, besides, hey, there's a lot of high taxes. I mean, that's like sort of cartoonized version of American history, right? You need to know who came, how was colonized from Europe, what the people who came, why they came, how they had structured themselves, within the previous 150 years or so before the revolution, to have some idea of sort of why it happened. And so that's why I'm so excited to have you on, because I heard your interview and I said, I finally know why things make more sense. It never quite made sense to me in that sort of version. So I don't know where to start. I guess maybe at the beginning is probably a better place. And then we'll sort of get to the part where people sort of have a misunderstanding that that's where history began.
Right. And also I should probably explain a little bit about our methods as historians, just so your audience understands how I figured this story out. The one thing I love about being a historian, and not to throw any shade on our friends, the social scientists, but our methods are that we have to look at primary sources and archival sources. So for this book, at first, when I was writing this as my dissertation, getting my doctorate at the University of Virginia, it wasn't clear that I was going to even be able to do the project, because the American Medical Association isn't exactly welcoming to researchers. They don't want people looking in their archives, and who can blame them? They need to protect themselves. And guess what? Insurance companies tend to be the same way. So I really had to do a lot of digging in order to find the sources, but I ended up finding so many, just at various like private collections of papers that people had left behind. I ended up being able to find pretty much everything I would have wanted from the AMA, with the personal papers of one of their very important post-war leaders. Then I was able to find lots of trade association papers from the commercial insurance companies, and then also Blue Cross Blue Shield. I was able to find tons and tons of stuff of theirs. So I just want your audience to understand how it is I figured this out. I've looked at board meeting minutes from insurance companies, board of trustees meeting minutes from the AMA, correspondence amongst physicians and between physicians and insurers, and back and forth, of course, then just tons of government documents, committee hearings and such, just to give them an idea that I've looked at, probably more than, tens of at least 20,000 sheets of, paper that are just primary sources, not to mention the existing secondary source literature. So that is how I started trying to figure out exactly what was going on with healthcare, because for me, the question I wanted to figure out is, why do insurance companies play the role they do in the healthcare system? Because I
Right.
did understand that it was a little bit odd, because they don't just finance services. They're kind of at the center of it, managing and coordinating the whole thing and deciding how much physicians make and even how physicians practice medicine.
Oh, absolutely. Yeah. So it's very interesting that you look at the primary sources, of course. I guess, the first question I have is, which is not really related to this. I'm actually surprised there's any correspondence. I understand the AMA might have, archives, but I guess I just wouldn't think insurance companies that may not even be around, back then today. How do you find these sources? I'm stunned
Well,
that there's like written records of meetings and stuff, or for, personal correspondence for people from 1918 or something.
yeah, this is this is the stuff we love. I mean, this really is a historian's happy place, is being in an archive like this. But really, there are sometimes these documents do get destroyed, but oftentimes when people are leaving behind their personal papers, if they're a leader in a trade association or professional association like the AMA, almost everything they have is important for historians. So sometimes this stuff is hard to find. For example, Blue Cross Blue Shield lost their archive, and I tracked down the son of the last archivist they had before they downsized, had budget cuts in the early 90s. They have their archive stored somewhere. They just, institutional knowledge being what it is, they forgot where it is. They don't know where they stored it. And so I tracked down the son of the archivist, and then went, and they had written a book about Blue Cross Blue Shield, and went and got all their papers. I mean, boxes and boxes and boxes of them.
Wow.
Because I even want to see things like the employee newsletter inside the Blue Cross plan. Like, I want to see it all.
Yeah.
So,
Well, that's how, because you're trying to figure out the culture too at the time, right? And knowing,
exactly.
what Pam is doing and what Fred are up to. I mean, that sort of gives you paints a picture of what life was like within the insurance company, and what they're sort of focused on as a company. They're
Yes.
talking to their clients, right? I mean, that gives you a rich feel for what's going on. And I think, it's easy as physicians to we have a very, I'll say modern, because that's just what we say when we're in the time, modern approach to medicine. But of course, medicine was very different in 1900, for instance, than it is in 2000. I mean, it's radically different in 100 years, much more science-based. Medical education is different. You could do many shows just on how medical education changed, and with the introduction of the various credentialing bodies that govern medical institutions for education. So I guess probably the best place as far as a fork in the road is probably this turn of the century, right? Like 1910s. And that's sort of where, why don't you just paint the picture for what medicine kind of looked like, I suppose, and the various forces that were struggling to sort of how we're going to, I guess, deliver care and pay for it, because payment is what drives a lot of what we do, and how we pay. Like you said, the insurance companies definitely dictate sort of how we practice, because we want to maximize our revenue in addition to take care of patients. And so you have to kind of do both those in tandem.
Well, 1910 is a great place to start, because there's a famous quote in the history of medicine that you see printed over and over again, and I'm not even going to get it correct, but it's something like, it was around the year 1912 when the average random patient stood to actually benefit from an encounter with the average random doctor. They weren't killing their patients as much anymore. So of course, students love to hear how, physicians killed George Washington and such, because that was all before the discovery of germ theory. So 1910 is a great place to start, because at the end of the 19th century, we get the discovery of germ theory, 1870s with Koch and Pasteur's experiments. And it's not something that's just, these discoveries aren't kept to the academy. The actual public is very excited about this too. It's hitting the newspapers. Everybody's very thrilled because they understand what this means for them. I mean, with a diphtheria antitoxin, that's a horrible one that comes to town and kills all the little kids,
Right.
so people are very excited about medicine. they are now want to access it more and more, this modern medicine. But of course, the costs and prices are going up a lot because now it is more effective and there's all this excitement around it. And medicine's very difficult to budget for because if you need something like a surgery or hospitalization, it's so much, right? Um, and you don't know when you're going to need it or if you're going to need it. So people are looking for ways to figure out how to pay for healthcare, right? Things like health insurance that allow you to budget because you know what your monthly bill is going to be. So if you look at the first, like say several 3 or 4 decades of the 20th century, what I would say is the healthcare market, very vibrant, tons of different ways of models. That's what I say. You would look at it and you would say, wow, there are so many models for financing and delivering healthcare. And it just depended on what group you were looking at. Businesses were contracting with physicians and hospitals. Some were hiring physicians on salary just to have them on staff. They were kind of
Mhm.
like, you can imagine in a factory, if there were a lot of, for example, media about other factories, progressive era, say muckraking articles about how dirty a factory was. One strategy was for businesses to hire physicians and bring them in and practice industrial medicine was big during this period. You had unions contracting with physicians and hospitals, also creating their own union welfare funds where they would hire physicians on salary for members. You have mutual aid societies and fraternal orders, which represented all the different immigrant categories you can imagine, from Croatians and Swedes to, the Irish and Russian Jews, whatever it may be. Everybody had their mutual aid society. These were very important. They almost always provided life insurance to their members. And during the beginning of the 20th century, they often were beginning to provide health insurance for their members, health insurance and the idea that you pay your dues and you get to access the physician with whom we contract. It might also be the physician often would be maybe even a member of this particular mutual aid
Right.
society or fraternal order. Your audience should understand there were thousands of these mutual aid societies around the country. And pretty much if you're an immigrant, you're definitely going to belong to one, because this is how, in the absence of the modern welfare state, that people took care of one another and you had mutual benefits that way. There were consumer cooperatives, farmers associations, all different ways of financing and arranging healthcare. But I do want to focus in on one, since it's the one I believe would have become dominant, and it's the one that I believe physicians will be most interested in hearing about, and that is the prepaid physician groups or prepaid doctor groups.
Mhm.
And this is interesting because this is what the doctors wanted to do. They formed groups, which of course you all are very, accustomed to practicing in groups, but instead of single specialty groups, they were multi-specialty groups. And that's the exciting thing about them, because medicine was practiced differently. The other thing that was so radically different about these groups is you paid your monthly insurance fee to the group, not to a third party. Okay, so the physicians acted as the insurer.
Sure. Okay.
So, and you also see too how this changes medicine if it's not fragmented care, single specialty, but a one-stop shopping where you really have responsibility for that patient. I'm sure your audience is familiar with this problem, but the problem with fragmented care is that if a person has more than one diagnosis, as often happens with the elderly, they can be very difficult, of course, to manage their care. Theoretically, the general practitioner is doing this, but we all know that the poor general practitioner does not have time to jump on the phone with, little miss, 5 different specialists and figure out, how to be treating her. And then, of course, some of the sadder cases are people who know something's wrong with them, but they can't figure it out. And they go from they just get sent from specialist to specialist. And once the specialist has run through all the things that the insurance company will reimburse them for, then they get sent to the next specialist, and nobody's responsible for finding out what's wrong with this poor person. And even if, like the sad thing too is, like, even if the person dies or is whatever's figured out about the person, that information doesn't get fed back into the system. So
Right.
there's
Right.
no
Right.
learning being done. So that's, the problem with fragmented care. But with these multi-specialty groups, the understanding is the buck stops here. So at the end of the day, they would discuss their most complicated cases. And I've always said that this would be a much more interesting way to practice medicine, because you're really practicing across specialty and learning across specialty, in a way, not quite as much. I know you do it today, but not quite to the same
No,
degree, right?
not at all. Yeah. No, I agree. So would an example of this be the Mayo brothers in Rochester, Minnesota? So that'd be, it's sort of
It
a
would be an
multi-specialty group.
example,
They weren't even physicians though, which was interesting.
except they were a physician group, right? And they're, of course, pushing surgery, at this point, and really helping create the modern field of surgery, and people, being even more comfortable with having it done. But they're not a prepaid physician group. So Mayo, they develop a reputation from pretty early on, where it is like it is today. People come from around the world to go there.
Right.
But with these prepaid physician groups, it's just, these are my doctors in my town. This is where I go. The Mayo brothers, they're kind of a special thing too, because the fact that the AMA ends up kind of even letting them survive, because that's the next piece we have to talk about. This is how the AMA is pretty much responsible for crushing all these different experiments.
Right. So I guess that's it. I guess you'd say, well, in a perfect world, which never exists, I mean, with no other outside political forces, right? The best methods sort of percolate up, they evolve, and they become more dominant. But obviously that's never the way anything ever happens. There's always other things that are going on that affect the way things happen. So what happens next? Because I mean, obviously we know where we end up. So how do we get there from a system where you have all kinds of different ways of delivering care? And it's funny because I think of my grandparents were in Rockford, Illinois, and there's a Swedish American hospital there, which I imagine was, because there are lots of Swedes, that probably was founded because there are a bunch of Swedes founded a hospital back in the 1920s or 30s. I mean,
and it might have been because of their mutual aid society.
Yeah, right. That exactly. Yeah. Right. And I think there's places like in Iowa, there's like a Czech place too. Now it all sort of makes sense how these things begin. Of course, we just see them as large parts of hospitals within health systems. But of course, back whenever they were founded, they were either, voluntary, like you said, mutual aid society, like the church maybe, or these various nationalities from immigrants.
Yeah, some of the large Black fraternal orders built their own hospitals and operate their own hospitals. So, I need to get us from what happened, but actually I'm realizing one more piece of information I want to clarify about the prepaid physician groups is, in addition to offering this integrated care and being such a fantastic way to practice medicine, is they were widely recognized for holding down costs. And they really could, because they could offer so many benefits in the 1930s that insurance companies and Blue Cross absolutely couldn't. Like, for example, they could cover obstetrics and pregnancies. And it's because of the financing. This is such a key part of healthcare. I'm sure you've discussed it on your podcast before. I just think it's, simply, if you look at different healthcare systems, usually there's the problem of either rationing or overutilization, right?
Yeah,
it's usually one or the other. Your audience probably knows that the United States is known as amongst the insured for overutilization, because of the idea of, running up a bill and sending it to a third party. But then a lot of systems, especially ones that are centrally controlled or socialized through the government, the main complaint is rationing of care and having to wait for a long time for a surgery or an important procedure. And so the amazing thing about these prepaid physician groups is they manage to thread that needle. I mean, as impossible as it is, I maintain it's the physicians that need to be incentivized correctly, since they're the ones with all this expertise, right? To walk that, like, who else knows walking the line between rationing care and overutilization? It has to be the ones who've trained for 10, 15 years, right? Not a government, like you see, and not a government official, not an insurance company official.
Sure. Well, I mean, I think, it's always, I say, it's like any business, right? I mean, if you're a plumber and you're charging too much, you're not doing enough service, you're not going to stay in business, right? So you have to find, I guess you'd say, let's thread the needle, but that's just kind of running a business. You provide what people want at a price that works and everyone's comfortable with, right? That's kind of what business is.
Well, and we all respond to incentives. I always like to point this out. I'm like, the doctors are responding to incentives like the professors and the journalists do too. Because you know how we like to come along,
yeah, right,
with, like, bad doctors. I'm like, We do the same stuff, right? So that's why you have to understand the system and how people are incentivized, because it's like, yes, you can point to some fraudulent doctors, but that's not it. They're just reacting to the incentives. And I know if I were a doctor, I would rationalize that I'm providing gold standard care and I'm just making sure, right?
Yeah,
And this is the way everybody does it.
sure.
So, what is happening is, because the way their physicians are paid under the prepaid physician group, it actually keeps all the incentives the way they should be. So under the prepaid physician group, doctors earned a salary. Of course, it would be based on like your specialty and your seniority, but they also got a cut of the profits, whether it was like biannual or
Yeah.
quarterly. So I think it's really important to tie doctors to the bottom line, that they care about how the business is going. So they don't want to ration care, because the last thing they want is their patients running around saying, don't bother with that doctor group. I mean, I pay them this monthly fee and I'm not getting good care, or I don't feel taken care of. The other problem with rationing care, when you own the patient's health the way these prepaid physician doctors did, is you could actually be hurting your financial health if you're not keeping them healthy with preventive medicine and everything else, right?
Mhm.
So you don't want to ration care in that sense, but you also have absolutely no incentive to overutilize care and to over provide procedures and services, because that's also going to hit you in your back pocket. So you see how it really is incentivizing the physician to do that exact right thing for the patient. Amazing.
Yeah. Well,
Imagine
right.
that. Imagine that world. So I do want to just say that these prepaid physician groups, because of that, they were massively popular. They're very popular amongst progressive reformers, amongst consumers. There were hundreds and hundreds of them, and just even in the 1930s during the Great Depression, and they had no problem signing up tons of families and customers because they were so popular. And yeah, they
So was that,
probably
were they mostly in cities? I mean, if you're someone on the farm, do you just have to go into town to access? I imagine you have to access these things, right?
a lot of them were in cities, but guess the farmers did a lot of consumer cooperatives,
Oh,
or
okay. So
tended to be
same
the
thing.
model. Some of them did prepaid physician groups, but the consumer cooperatives, because a lot of those were actually started through some New Deal experiments, copying experiments that were already in the private market, where they would just have like the Farmers Association meet with the medical society and like work out a fee schedule and
Mhm.
figure
Okay.
out little programs, like, because of the New Deal and everything going on. But yes, a lot of these, obviously, as you can imagine, would start in cities, especially if they're multi-specialty. You have like, surgeons and an ophthalmologist and an obstetrician and bunch of GPs and such.
Right. So there's not a lot of love for the American Medical Association on the show. The AMA has not been, partly because of their incentive structure. Now their incentive is to maintain their CPT coding. So they're not as responsive to membership complaints or concerns, I should say, not complaints, concerns, because their revenue is actually mostly non-dues revenue. I think like 85%. And so what members want, they don't care. That's why they don't even care if they have members. In some ways, you respond to your incentives as an organization, and your number one incentive is to survive. And if that means not having membership being an important part of your financial sort of underpinning, that's fine. We're just not going to, we're going to make sure our organization continues on. And this is every organization, whether it's a government institution or it's a business, right? Or a family or whatever, right?
Mm-hmm. And the AMA is not nearly as powerful as it used to be.
Okay.
Of course, they're always going to be called, it's a kind of symbolic. What does the AMA think? Because they're still in everybody's mind standing for physicians, even though we know that the specialty societies are far more powerful than they used to be, and more important than they used to be. But yeah, in the 50s, 30s, 40s, and 50s, you did not want to cross the AMA. And so that is what I will explain to your audience, is they're probably wondering, hey, you're telling us that there were all these great experiments in the healthcare market. There were hundreds and hundreds of just this one model, the prepaid physician group, not to mention all the other models I was talking about, from union welfare funds to business solutions for their employees. But what happened was that the AMA was against all of this stuff. They were against physician groups. They finally are going to let go on physician groups if they're single specialty, of course, but definitely no multi-specialty groups. And they were against health insurance. And a lot of people were surprised to find this out, because they know that the AMA opposed socialized medicine and government intervention in healthcare, but they're surprised to find out that I always want to tell them the AMA hated the idea of Doctors being part of a free market or competitive market was anathema to them. They absolutely did not want to have anything to do with that idea. It was as horrible to them as socialized medicine. So I just
Why
want
is that? I guess I
correct
don't
that
understand. Yeah,
misconception.
why do they have such opposition to these market solutions? I mean, because it sounds like they don't want. Is it just an idealized thing? Every physician should charge the same because we all have the same knowledge, and we want to make sure that there's no that business is ugly, it's dirty, and so we don't want competition. And so, sort of like you're not. It was very. I don't know. Even like in the 80s, I felt like you didn't really advertise as a physician because
Mhm.
it's dirty to be part of business. We're above
Mhm.
that. Is that the thinking behind it?
That's absolutely part of the thinking behind it. We are gentlemen of science. Like, how dare you even imply that we might? Because think about it, the market is looked at differently than it is today. Today, we don't have as much association as with commercial as low class, but to them, you're asking them to give up their, gentlemanly stature as experts and scientists to go into, yeah, a dirty, crass market where you would just have common peddlers peddling any kind of wares. I mean, the common medicine man might come to town and you're asking them to do that. That's what they're thinking, okay? That professionals don't do that. And we are professionals. This is a class thing. So that's part of it. The other part of it is what the market is doing in the United States at this time is creating the rise of the American corporation. Again, something that even though there's pushback and can be controversial today, we still probably don't understand the fear that people had during this period, especially professionals who are worried about the American corporation subsuming them. So think about the engineers, for example, how they get pulled into the American corporation, and physicians are saying, "Oh no, we're not going to have an American corporation develop around us where we're answering to non-physicians, non-experts," right?
Gotcha.
Um, so they're thinking that, and prepaid physician groups and all the other experiments. The problem with that is if you have a multi-specialty group that looks like, oh, a nascent corporation with departments getting ready to develop. If there's health insurance, there's capital pooling, right? All these things look like, they're going to develop into medical corporations. And they specifically are saying that.
Ah, okay. Well, that makes a lot more sense then, because avoiding the corporatization, having overlords telling you, dictating how you practice medicine. Well, good thing
Right.
they stopped that in its bud. Yeah, right. That's a good thing it didn't happen.
Right. Right. And can't you hear them saying that supermarket medicine?
Right.
Like that whole idea of being in the marketplace. Like, what do you think? We're just like grocers, common grocers. Like, we are men of science. And of course, physicians are all excited too, because for the first time now, they actually have legitimacy in society. People are really starting to look up to them. I mean, their star is on the rise. You would be surprised how they were not very respected in the 19th century. Before the discovery of germ theory, the jokes are, oh, too amoral for the pulpit and you're not smart enough to study for the bar. So yeah, go into medicine. Those are
Yeah. So the AMA now at this point, they're in kind of a weird position because they're opposed to corporatization of medicine, but they're also opposed to socialization medicine, which I'm sure they're New Deal, right? There's obviously calls, and I know there's mention that FDR was interested in creating a health insurance market that the government pays for healthcare, in addition to the Social Security. I think it was going to be part of the Social Security benefit, wasn't it? I think it was to try and tag this together. So they want to oppose that as well. So, I mean, I guess they want to just keep the status quo, which is not unusual. Most organizations don't want anything to change. Unfortunately, the world's always changing. So you got to figure out some way to navigate that.
right.
So I guess, how did they pivot? What happened?
Yeah. So amidst industrialization, after the discovery of germ theory, modern medicine, everything's changed with the AMA is like, no, we are keeping this 19th century economic model for healthcare. So as you said, in the 1930s, there is a lot of political pressure on the AMA. There had been suggestions for government funding of healthcare before, but always at the state level, right? Now it's at the federal level because, like you said, the Great Depression, New Deal era, of course, they're looking at healthcare because the AMA is doing everything they can to destroy the private market, which is basically inviting the government in, right? They're creating a problem that the government has to solve. FDR understands that he does not want to go up against the AMA and the medical societies with the 1935 Social Security bill, even though of course, the people in his administration want to put in funding for healthcare, but he's worried it'll sink the whole thing. But this is the period where now the federal government, the pressure is on, because then FDR creates a technical committee, calls a national conference. For the first time, you have legislation in the Senate being offered by Senator Wagner for federal funding for healthcare. So the pressure is on, basically. And so this is the reason that the AMA has to compromise. This is the period at the end of the 1930s where they realize, okay, we can't fight the two-front war against the marketplace and against the government. We've got to, re-strategize this. And so what they decide to do is they decide to just make up a market model, which is the model that healthcare is run on today. I know this sounds insane, but this is what happened. And it's not an efficient economic model if they had to make it up and the market didn't produce it itself.
Right. Yeah.
And I'll explain that in a second. So they make up this model, then they call this, they wouldn't have called it the private market solution because the rhetoric then would have been voluntary, right? First they're fighting the Germans and the fascists, in the teens and 20s, right? If anybody wants to intervene with government medicine, but then after that, it's against the communists. So they're trying to create, even though they make up this model and force it on everybody, they're going to relabel it as, hey, this is the free market, which you can see, especially after we get out of World War II, is going to be important for the way you set up that political contest, free market versus communism type thing, Americanism versus Sovietism, even though that's not what's happening. So they make up this model. They won't allow physicians to practice in any of the other models because they'll take away their license. They own the licensing boards. Physicians know they will immediately lose their hospital admitting privileges. This was a time where you all had more power over the hospitals. Now I know that situation is reversed. And certainly too, you would lose any referrals if you were a specialist. If you don't follow along with what the AMA says, which means no health insurance, no practicing in doctor groups, no contracting with mutual aid societies, consumer cooperatives, farmers, prepaid groups, whatever it may be. So what the AMA does at the end of the 1930s, it says, okay, we're still going to be against all those models, and we're still going to take your license and destroy your career and come after you if you have anything to do with them. But now we're going to allow health insurance, but you still can't practice in groups or anything. You still need to be practicing individually. And the health insurance we're going to allow is only health insurance through insurance companies, not the unions, not the prepaid physician groups. None of that.
And not the government, right? That was
not the government, only insurance companies. They make this bet with insurance companies because they're thinking insurance companies are located in one place, physicians all around the country. It'll be very hard for the insurer to supervise us. Whereas all the other models for financing and arranging care, it's all local. It's all happening right in the same place. So they decide to do that. The rule is the insurance companies have to pay physicians on fee for service, no capitation or salary. And the other rule is that the insurance company absolutely has to give the physician complete autonomy, no asking questions, no supervision. And this is the model that the AMA creates, right? And the insurance companies take a look at it and they realize you're asking us to pay for services for which we can't even forecast. Like we can't forecast the supply of those services because we're not even allowed to ask anything. We're not allowed to supervise you. We don't know. But that was the bargain, right? The insurance companies don't want to get involved in this. They didn't even want to get involved with some of the other models that would have been more efficient. I found a lot of this in their archives just because they're worried about moral hazard and losing money with healthcare. But the reason they go ahead and get involved with the AMA, and this is what I call the insurance company model, this model that the AMA creates at the end of the 1930s, that the market doesn't produce because it's insane, it's crazy, and everybody recognizes that it's crazy. But it's the insurance company model, and this is what the AMA is going to, stick to, and this is what we have today. Okay, so they choose this model, and it starts to grow. Insurance companies decide they're going to get involved because they don't want socialized medicine or nationalized medicine. In the 1940s, especially, even while we're in World War II, it's very clear, coming out, there's going to be, the question is, are we going to go more towards the European countries with large welfare states and maybe a lot of nationalized businesses in the energy sectors and transportation, healthcare and such? Or are we going to, to do something different? And so the idea for the insurance companies is that they're going to ally with the physicians to keep out nationalized or socialized medicine in order to protect the entire business community, right? Because the idea is if healthcare falls, then it's going to create a precedent, kind of like domino theory, and it's going to
Right.
go through all the different, business sectors. And so they got to hold this back. So that's why the insurers are like, fine, we'll get involved with this crazy deal. And we're just going to do a little bit. We'll just, we'll just cover employee groups. We'll give them very narrow policies that just cover catastrophic, costs, just cover 60 to 80% of your hospital costs, mostly for accidents. Some diseases might be only listed in the policy. Very, very meager policies, but we'll do a little something. And this way we can tell government officials, you don't need to get involved. The private market has this covered, right? That's the idea of what they're going to do. And so that becomes the argument, and it's very explicit. Every insurance meeting, almost every AMA meeting, this is what they're explicitly saying to one another. We have to grab onto this, healthcare insurance thing. The doctors are still, the AMA leaders are still mad about having to go towards health insurance, like Morris Fishbane, for example, the famous, JAMA editor. But they're saying we have to accept it and we have to grow it in order to keep the government out of medicine. Okay. Does that make sense to you?
Yeah, completely. It's disappointing, but it's actually understandable because, we have benefit of hindsight to look back and say, well,
yes,
I mean, obviously what's going to happen. So essentially you had a system designed. It's like any negotiation, right? You have only one side negotiating, and you have just the AMA who's dictating all the terms. So they're obviously going to be to the AMA's benefit, or, their members, the physicians for the most part, right? I mean, so you're saying either they developed an insurance company or model that says, okay, insurance companies, you have to insure for you can list what you want, but essentially you have to take whatever it is that you have no control over costs. You have whatever the physicians say it costs, or the hospitals or whoever, that you just have to pay that. I mean, anyone looking at that knows that you absolutely know the next step. You know what's going to happen.
Yeah.
That costs are going to go through the roof, and then you're going to try and make up for that by increasing premiums, I suppose, or, either because if you feel like you can't restrict the actual services, there's only one option. That's just to charge more money. But but unlike death, like for life insurance, well, at some point someone's going to die. You can guess how long it's going to take them. Here, you have no idea how much is going to happen between, this year and next year, what's going to be covered, right? So costs are going to explode. It's going to be great for physicians for a while, as long as you can keep this running. But at some point, it's not, right? So I'm sure we kind of know what happens next, right?
Wow, that's great. You really see the writing on the on the wall. That's fantastic. Yes, exactly. Oh, and this is back in the day too, where there weren't even fee schedules. So yeah, you just get to make up what you're charging as well.
Oh, that'd be great.
I know.
about
I'm
10
always like,
years.
it would have been a great time to practice medicine. So it's fine for the physicians still, but as you can see, they're going to get themselves in trouble, because if you're trying to make a political argument and then all of a sudden costs are shooting up all over the place.
Right.
And then in the 1950s, we have an unnecessary surgery crisis, because this is where then the fraudulent doctors. So it's one thing for everybody incentivized one way and little padding here and there, because everything's creeping up and you're just keeping up with everybody else. But it's another thing when, it just takes a few fraudulent people to really tarnish the entire, the profession, when it's
Sure.
like, 80% of the, appendectomies you performed, you're removing healthy organs. Like, we expect it in 10%, but
Right.
70,
right.
80%, is concerning. So exactly what you're saying, the costs are out of control, and it's not mostly because of fraudulent doctors. I don't, there aren't a ton of those, just as much as you would expect, but the costs shoot up even on these meager policies. So in the 1940s, I would say in the 1940s, they managed, the AMA and insurance companies managed to cover about a quarter of the population with these very narrow insurance policies. But this only serves to continue the calls and the political pressure for some kind of reform, because people don't think that's good enough. Right.
Yeah.
So that brings us to the very big healthcare battle that probably most people in your audience are familiar with. And that's at the end of the 1940s, beginning of the 50s, with Harry Truman's push for universal health insurance. That's really important, again, because it's very clear. If you look at the debate that happens nationally, is, You have the physicians and insurers saying we don't need a government solution. It's, it's communist, it's Soviet, but also we have a voluntary solution. We can take care of it in the private market. But then government officials will say with that, with that model, like people around Truman are saying they'll never manage to cover more than half the population with that,
Right,
and of
right.
course that makes sense. That's a rational forecast because they're looking at this insurance company model saying, how are you going to spread it to everybody when it's so expensive and causes costs to shoot up? So the Truman administration is making the argument to voters that, hey, if we pass this legislation, then not only will everybody have health insurance, but it'll be so much more generous than these pathetic policies
Yeah.
that those who are covered have. So you see, it's very explicit what's good the messaging is. Now, of course, Truman's plan is defeated. The AMA, along with not just insurance companies, but chambers of commerce, National Association of Manufacturers, all the business interests, they managed to defeat it. It's a massive campaign to defeat it. But the important thing about it is that the argument that the Truman administration was making seems to have been accepted, because even the Republicans and conservative Democrats who opposed Truman's bill, they still wanted healthcare reform because they still believe that there's a big problem with the model, the way it's developing, the fact that so few people have health insurance, and those who do are paying a lot for very little coverage. And then, of course, during this entire period, every single year, the cost of health insurance are shooting up so much. I mean, you see the insurers talking about it because they're not used to this happening in their, life insurance lines or their property and casualty, where it's like shooting up 35% every year.
Yeah, right.
And they're making weird jokes about only being able to skin a cat once. And, so they're really like, oh no, what are we, so this is a problem too. So, so it's so interesting because even though Truman's bill is defeated, all under President Eisenhower, you would think, oh, well, he's a Republican, surely, they had peace, the physicians had peace and didn't have to worry about government intervention under Eisenhower. No, Eisenhower wanted to reform the system too. He himself had a proposal for reinsurance that actually looks a lot like the mortgage market insurance. Basically would have compensated insurance companies for losses if they covered people who were either chronically ill or elderly, or if they expanded the generosity of their policies made the benefits more liberal. And if they lost money, then the federal government would compensate them for those losses, which is like,
right,
mortgage insurance with the bank.
So the, like I said at the beginning here, the story is always, well, there are wage controls after coming out of World War II. How much did that influence it? Did that just change some legislation saying, well, we're not going to tax things, we're going to tax things a little differently when it comes to insurance benefits, and that's going to accelerate the use of health insurance for companies? Or was it just other forces that sort of moved us towards a higher adoption of health insurance as a part of your employment?
Yeah, I think that is way overblown. I've looked at the data. So have a couple other scholars, Jennifer Klein and Jacob Hacker. That the story of the wage freezes in World War II causing health insurance to take off because employers wanted to provide health insurance as a fringe benefit in order to hire people when the markets, when labor was so scarce. The numbers don't indicate, I mean, they show an increase through World War II, but not any different than you would expect, because there's just an increase, a steady increase happening, which I argue, along with the other scholars I mentioned, is really due to the fact that employers had a nice fat tax write-off for supplying fringe benefits. They're more concerned about the unions, and they're also concerned too, they're even thinking about making the political argument about, hey, we're covering our workers with healthcare, so we don't need nationalized or socialized, healthcare as well. So yeah, there's an uptick through World War II, but nothing dramatic or what you wouldn't have expected. So it's just this, when the IRS is founded, in the 19 teens, somebody just allows this tax loophole where the businesses get to write off whatever they spend on fringe benefits. It just kind of sticks around for a few decades until policymakers start saying, wait a minute, we're foregoing millions of dollars in tax revenue. We need to do something about this. But conservative Democrats and Republicans they want to help out those who are trying to, push the private market against like a socialized solution. So in the 1954 tax revenue bill, it's institutionalized there. So that tax write-off that employers still get. And of course, this messes up the market in all kinds of different ways, because we were just talking about how much prices were shooting up through the 40s and 50s because of this insurance company model, and the way it causes costs to rise. But a lot of these problems are being hidden by the people who have the policies because their employers purchasing it for them. Right. I find it you probably talk to people today, I'm sure people in your audience have, who think that they only pay $100 or $150 a month for their health insurance.
Right. Yeah. Right.
Because nobody said, you're missing $35,000 in salary, and you just let your employer choose your health insurance policy and company. Maybe you get to choose between two if you're at a Fortune 500 or something.
Yeah, right.
Or actually, if you're the best is if you're a federal worker, but we won't go there.
Yeah. Well, it's interesting because I look at that too, and I think to myself, most of the time when I hear the story about the wage controls causing a change in the health insurance market, I've always heard it from physicians, and it actually wouldn't surprise me if that, I don't know, fable, whatever is perpetuated a little bit by the AMA or for physician groups in order to sort of remove culpability for their play in that. Because I've never heard the story of the AMA really establishing the insurance market. I mean, you hear lots of stories as a physician of the AMA fighting tooth and nails against Medicare and the establishment of government insurance. Eventually they sort of relinquish in trying to make it as advantageous as they can for physicians, but recognizing, I guess, the writing's sort of on the wall as far as we're going to have the introduction of a federal government sponsored insurance program.
Well, one reason for that is the way the healthcare market and the AMA has been looked at. It's mostly been looked at as the AMA has been looked at, but not insurance companies. I'm one of the very few. Jennifer Klein is another scholar who's looked at insurance companies, and now people are starting to more and more. But you have to understand, when I said I want to look at insurance companies, that was kind of unusual. I mean, there's so much on the AMA, and one of the reasons people didn't write about insurance companies is how hard it is, obviously.
Yeah, well, there are a lot of them.
Right.
There's one AMA, there's, hundreds of insurance companies.
Exactly. And so one of the big arguments I make is, hello, you can't understand healthcare politics unless you understand the market and the economic history. And so that's like a new argument I was making when my work came out in 2015. So things are changing. Healthcare is now starting to be looked at as a business. And I know that must sound weird that it's like, wait, it wasn't looked at as a business before. So one of my home conferences is the Business History Conference. And when I first started going there as a graduate student working on this project as my dissertation, a lot of people are like, what are you doing here? What does healthcare have to do with business? And you're like, well, first of all, a fifth of our economy goes to it. Second of all, yeah, it's not just insurance companies, but have you heard of the pharmaceutical industry? Like, maybe. So it's funny because now it's kind of more of a hot topic to look at that way, is, through the lens of whether it's history of capitalism or economic history or whatever. So I think that's been a disservice that has been done. And now economic historians and econ departments are looking at it more and more, but it's not nearly as developed to say, they're generations into looking at banking, and very sophisticated there. I don't think economists have been terribly sophisticated yet with healthcare. It's a new field for them. Right. So anyway, this is a little something to your audience to understand that I don't think it's been of service to look at, because some people say, oh, it's offensive to talk about healthcare as if it's a business or that there's a market or economics to do with it. And how dare you call patients customers? But who are we kidding by just pretending and not saying what's happening?
Right. Yeah. I do understand on some level referring to patients as customers is not entirely accurate in the sense that it's a different dynamic between them, but it's probably similar to a lawyer calling their clients customers, right? We call them, they come clients instead of patients because it is a different relationship. But there's still a business aspect to it, where there's money exchanged. I mean, there is, so you have to appreciate the fact that there are, people close doors and open doors for bankruptcy or whatever. And so that
Right.
There
And
is,
we don't want physicians like, right, calling their patients customers or thinking of them that right, obviously. But when we look at the market and how it developed, the fact that we are like, well, we can't look at the economic variables because healthcare has nothing to do with that, or it shouldn't. That's the thing, is this wishful thinking. Healthcare should just be free and it should just be growing on the, well, it isn't. It's a
right,
scarce commodity service. So we need to
right.
figure out how it's been financed and distributed, is my point. Because healthcare, I disagree with the idea that it's just this super, super special thing that doesn't conform to any economic laws. I just don't buy that. And I've argued this in all my, and I think it's only done a disservice to you all, because if you're not looking at things clearly, it's hard to see where you're hurting yourself long-term or not. Because the AMA, who can blame them for not wanting physicians to work in big corporations?
Yeah, right, right.
Right. I get that part of it. But then they end up endorsing a solution that creates the very thing that they feared.
Yeah,
Right.
right. Well, and it was inevitable, right? At some point that you're going to end up in some sort of entity that's going to be, for efficiency reasons, you're going to end up in like a large multi-specialty or single specialty group at some point, whether it's within a health system. It's just who's going to control it, right? In
Right.
some
And
ways,
it
that
might as
probably was
well
going to.
be,
Yeah.
operated and financed by physicians is my only point
Yeah,
instead of
no, absolutely.
another.
Right. I think,
Yeah.
and we talked a lot of times, like I said, we talked about direct primary care in the show, about those direct to consumer markets. Yeah, it's interesting because, I think, yeah, healthcare is really important. People say, oh, it's the most important thing. Well, I would disagree. And I think the most important thing is having food. And we've never looked at farmers as like, well, it's, yes, there are people who wax poetically about farming and how important it is. And it absolutely is. And I have relatives who are farmers, and it's a really hard job, et cetera. But there's never a view of them as like as noble, I suppose, right? I suppose it's just because they don't go to college and they can't write the narratives themselves, that they're just, the guys or women, out there, growing food. And it's been something done for thousands and thousands of years. So maybe it's just seen as more of a regular sort of profession than medicine, which is fairly recent, and that came out of the academy.
No, medicine's been
Well,
around
but I
for
mean, at least the
thousands of
modern
years.
medicine, the way physicians are viewed
Right.
now, right? I mean,
Yeah.
I think, yeah, I think a physician looked at in the 1700s, like during, say, the Revolutionary War. I mean, it's, as you mentioned at the onset of the show, totally different than what a physician's looked at now from a prestige standpoint.
Mhm.
And their knowledge of what they're doing was very rudimentary, right? You knew some anatomy and you apprentice. I don't know. I mean, I'm just guessing why it's so different, but there's always been that mentality. And I think it's because it just exploded so quickly and became so specialized in the 20th century. That's why these attitudes sort of progressed within the AMA.
Right. Because
Because of the academy. I don't know.
look, where you hear people saying you have to socialize healthcare, but okay, then you have to socialize housing, you have to socialize food growth, then that's my point, is there isn't anything extra special as far as when analyzing this from an economic perspective. So I guess in my narrative, I've gotten you to the 1950s, so I need to get you through.
Yeah, right. I mean, I guess,
what happened.
and I would say at this point, I mean, you can kind of see everything that's going to happen, right? You can see Medicare, you get the national insurance programs, and then you get well, now we had that, and now we have the private markets messed up. So we're going to try capitation with HMOs and, I think, all that sort of thing. So I guess you walk us through the rest, but I think at this point, so the writing is on the wall now. It's just the inevitability of getting to where we are today.
But basically what happens is, the insurers and doctors, they partner up and they just run as fast as they can to expand this one particular inefficient insurance company model. And they have to do it real quickly because all through the 50s, Eisenhower and then tons of people in Congress are offering healthcare reform packet, because there's this understanding we got to do something. Republicans
Right.
think it, Democrats think it. Okay.
Mm-hmm.
So the costs are rising. This is before Medicare is passed in 1965, but they're running to expand it and cover everybody they can. The insurance companies are even losing money to do this. They're really going out of their way to cover as many people as possible and expand benefits. Insurance is developing to become more and more like what we see and expect today, as far as covering, physicians visits, not just hospital services, preventative medicines, labs, diagnostics, etc. This is happening. They're running ahead of reform, but then at the end of the 1950s, the debates around Medicare start heating up with you have not covered enough of the population over age 65. Believe it or not, insurance companies actually crazily try to cover people over 65 with the insurance company model. They go so far as getting special state enabling legislation to get around antitrust bills so they can pull together their resources, money, administrative capacity, and everything to try to cover people over 65, again, with very minimal policies that just covered maybe 10 to 20 days of hospitalization.
And these people aren't employed too, which is important. This is the problem, right? If your insurance is through employment at this point, now you're not getting the medical coverage which is why there's this hole, right?
Right. So they have to pay all this money for very little coverage. They actually end up, though, covering half of the people over 65, which to me is mind-boggling. And of course, they're losing money like crazy, which means that walking into the Medicare debates, the AMA is still massively opposed, but a good half, at least, of the insurance industry, if not more, is either actively pushing for Medicare because now they can offload their sickest, customers to the government to take care of, or is just kind of sitting it out. There are a few, that are still fighting with the AMA, right? But the AMA is pulling out all guns against Medicare like it did with Truman. But this one is actually just going to cause them problems because they're against a lot of their own membership, their own base, right? A lot of their membership is against them. Their membership was with them on Truman. Their membership is not with them on Medicare. It's very divided, right? Then the Medicare bill is so popular, the Kennedy-Johnson version of the bill, of course, it draws some Republican votes. But the point I would also like to make is even the Republicans who didn't vote for that bill had the alternative that they wanted to vote for. And this is because of that explicit race that they had set up of the private market versus the government. And everybody was saying, look, you tried, you didn't do well enough with we had a deal, you didn't come through on the elderly. Because they would I even have places where the congressperson would show up at an AMA meeting or an insurance company meeting and say, if you don't do X, we are going to do this. Right. That's how explicit the whole bargain was. So Medicare gets passed. And that is really where a lot of the AMA really kind of gets destroyed around here because a lot of the ill will and things that happen and with their base. So they really hurt themselves here. And even the Republicans feel like they get burned by them, that their association with them hurts them a lot in the election. So this is kind of some of the political decline. But the thing that is so important for your audience to understand about Medicare is once it comes around, remember, you had all these politicians doing everything they could to get rid of the insurance company model because everybody, conservative, liberal, progressive, whatever, thinks it's crazy. But by the time we get to Medicare, they recognize it is so entrenched in the market. There's nothing we can do. We can't displace it with our own model for Medicare. And I even have them talking about this, darn, now we're going to have to build Medicare on the insurance company model. It makes it nice politically too, because then they can make the argument, hey, your parents over 65 will access the same insurance companies and physicians you do, et cetera. They just couldn't at this point in the 60s, the federal government couldn't cover that, that many people with these benefits. And so not only do they build Medicare on the insurance company model, they also then tap insurance companies to administer the program to be intermediaries between the government and providers, hospitals, and physicians. And that's kind of when it's just too late. Now the insurance company model is legitimized, kind of this. Everybody forgets that everybody's trying to get rid of it before. And then thereafter, it's just cost containment. Lots of legislation, the HMO legislation in the 70s, and then at the states, all the certificate of need laws, and then all the laws trying to contain costs, but building up all these institutions around the insurance company model, which now today then causes direct primary care problems. Because there'll be laws on the books in states like, oh, a physician can't own their own laboratory. Because under the insurance company model, you see your patient, send them across the street to your lab, have all the labs done, right? Run up the bill and send it to the insurer. But then today, this is a problem, obviously, for other models. But you see how all these institutions get built up and entrench and further embed this very inefficient model that's caused costs to go up and has made medicine not as exciting to practice for you and even reduce the quality of medicine somewhat. Although one thing I am always pushing back on is this idea that the United States has poor medicine. Like I don't, these ideas that people want to go to Cuba to get healthcare are insane to me.
I
And
I don't know who that is. That's people who
that's
obviously
Michael
are live in
Moore.
Cuba. I don't know.
Yeah, that's
Sort of a
Michael
choice.
Moore's. That's his
Yeah.
documentary. I so tell my students, and I'm always like so disappointed that so few of them are like, wait a second, who's really going to go to Cuba for healthcare? Like, I'm always disappointed how few get that. But
Yeah. Well, there are so many problems, and you can see how a lot of it stems from these decisions that happen, and people, I go on shows and I'll say, hey, how do you fix healthcare? Like, well, you got 5 minutes. Yeah, it's a joke, right? But you have to basically burn the whole thing to the ground. I mean, and that is not an easy endeavor. That's not something you can just do tomorrow. And you can't, I mean, essentially you can't do it. But what's really interesting too, I think, about this discussion is you see the models now that are emerging. And I think this is where medicine will go eventually, is you're going to have more of the direct contracting, direct provider. And you're going to see the healthcare, these health plans, I think you're going to see them breaking apart. I think it's ultimately what's going to happen. It's not a sustainable model. And you see them sort of onesies, twosies as they lose the lucrative surgery centers and et cetera. Unless you get some sort of legislation to stop that, I think that's ultimately where things are going to go. It's why I'm actually optimistic about healthcare in general in the United States, because I think that this is happening not only for physicians, but also for the patients. I think you have better access. But you can definitely see with the model, when you have a model that is paying whatever people say, like, it's this, whatever a bill I send, it's going to get paid. You can see how, even if you had another model at that time and tried to keep it, if there wasn't even laws against it, it's still going to die, because it's not going to be as lucrative as the insurance model. So you can see why in the 40s and 50s, even if you try to have a direct to consumer model, it's really, unless you're really unusual like the Mayo, it's not, and even they're accepting insurance too. So you can see how it sort of unintentionally squashed that market completely. And so that the innovation that may have occurred in those markets never had a chance to occur, because they were up against something that had, unlimited pay. So obviously you're going to go work for the place that pays whatever you say. I mean, who wouldn't do that until, of course, it stops breaking down.
Right. And then the AMA is not going to come after you and get your license pulled and your hospital admitting privileges revoked and everything else. So
that's interesting too, that they were that powerful. Yeah. I didn't realize the AMA was that powerful, that they control the medical boards, and that would just, and they would actually, you would lose your license if you just practice the wrong way.
They even printed, I even have when I give a talk, I usually read a quote from a JAMA editorial in the 1930s. It's like, yeah, we'll come after you. And I laugh about it because they're like, don't you dare enter into some contract with a commercial agency, or, the 6 or 7 years, which you paid for of your life will be for nothing. But it's like, here's the most prestigious medical journal in the world at the time, taking a time out to threaten their own members. And so, yeah, what your audience does need to understand is the AMA had incredible power that they don't have today, because they own the state licensing boards pretty much. They acted like government regulators, so they could do whatever they wanted with the healthcare market. And that's how they molded it. But they don't have that power today. They don't own state licensing boards like that today.
No, I mean, their members usually are on the boards, but yeah, they don't have they wouldn't be able to get away with those sorts of anti-competitive practices as easily. Now it's pretty much, you have to do some fraudulent activity or commit crimes essentially to lose your license. Although that is changing now. California, they passed that, which I'll have to talk to someone about that with their misinformation rules. And so that's a totally different sort of
the government
situation.
Really, regular, because I know there's a big opiate problem too, with doctors not being able to just prescribe things they've prescribed for a long time.
Well, right, that's another thing too, but that's not something the medical boards go after. That's more like a DEA. But you're right. I mean, and this is, of course, if you're a libertarian, you're like, well, this is why licensing rules are dangerous, because if you're going to restrict trade with the license, you are at risk for the whims of the license board. If they change their rules or what they, you're obviously at risk. So,
but what you try to do then is you need to control the licensing board, so you keep all your competitors out.
Well, absolutely. Right. That's, no question. But, how do you control those people? And all those things happen. And well, anyway, that's another discussion, I suppose. So Dr. Christy Chapin, thank you so much for coming on The Paradox. I'd like to encourage people to check out your book. And we're talking about, obviously, it goes much more in depth, Ensuring Health, America's Health, Public Creation of the Corporate Healthcare System, which, I mean, if you've found this discussion interesting, absolutely pick up the book. I'll be a link to it on the website theparadox.com. I think it'll be 174. I should keep track of my episodes, but so far now I can barely remember. So thanks again for coming on the show. I really appreciate the discussion.
Thanks so much for having me, Eric. I appreciate it.